Hello everyone, my name is Noel Olvera and my presentation is over the Baylor Scott and White Health System, Strategies and Competitive Advantages. My executive summary over the Baylor Scott and White Health System is a nonprofit organization that provides numerous services to residents across the state of Texas. This report or presentation is to communicate information that has been compiled as a result of research and analysis of the Baylor Scott and White healthcare system. We will be using two tools and theories to analyze this. SWOT analysis, which identifies the strengths, weaknesses, opportunities, and threats of the organization. And second, it will be the Miles and Snow theory, which outlines the organization businesses level strategies using these four categories: prospector, defender, analyzer, and reactor. Through the above research analysis, some recommendations will be suggested to the Baylor Scott and White healthcare system. The Baylor Scott and White healthcare system is the largest non-for-profit healthcare system in Texas, as well as one of the largest in the United States. The system was founded when Baylor Healthcare System and Scott and White Healthcare merged. Today, the system has a total of 48 hospitals, more than 800 patient care sites, more than 7,800 active physicians, and over 47,000 employees, as well as the Scott and White Health Plan. The Baylor Scott and White healthcare system holds their mission, ambitions, values, and strategies high, as they are used to leading business aspects and guidance towards the development of business strategies. The organization is founded as a Christian ministry of healing with the mission to promote the well-being of all individual families and communities. The healthcare system strives to be a trusted leader, educator, and innovator in value-based care delivery, customer experience, and affordability. Baylor Scott and White healthcare systems is centers in business models around the following five cores: to serve faithfully, to act honestly, and to never settle, and we are in it together. The strategies include the following: health transformation into an integrated network, and the ambitious and consistently provided exceptional quality care. Experience achieve the market leading brand by empowering our people to design and deliver a customer for life experience. Affordability to continuously improve our cost discipline to invest in our mission and reduce the financial burden on our customers. Alignment ensure the consistent result throughout the streamlined leadership approach and unified operating model. Growth pursue sustainable growth initiatives that support our mission, ambition, and strategy. The Baylor Scott White healthcare system offers many products and services such as hospital services, rehabilitation centers, primary care clinics, specialty care clinics, ambulatory surgery centers, senior health centers, urgent care clinics, and retail pharmacies and home health services. After conducting the SWOT analysis to the Baylor Scott and White healthcare system, we found that their strengths are effective network, strong reputation, and strong leadership, where to their weaknesses is that they lack geographical concentration. And with that being said, their opportunities is to expand in their demographic. With Texas being such a large state, there's a lot of rural areas that need some of the Baylor Scott and White healthcare system to be available. One of the threats to the Baylor Scott and White healthcare system is the lack of skilled healthcare professionals and a strict government regulation to a nonprofit organization. After conducting the Miles and Snow model theory to the Baylor Scott and White healthcare system, we found that the Baylor Scott and White healthcare system fell into the prospector strategic type. The prospector tends to thrive in innovative, dynamic environment, capitalizing on growth opportunities. The Baylor Scott and White healthcare models this behavior with their continual success with their population health strategies. Within the Baylor Scott and White Health North Division, readmission rates dropped by 15%. The admission per 1,000 were reduced by 9%, based off their internal project analysis. There was a 10 million saving in medical costs within 2 years. Sadly, Texas Tech Health Science Center is not one of the Baylor Scott White healthcare system's top competitors. But the top three are Texas Health Resources, also known as Harris Hospital, the HCA Healthcare, and UT Southwestern Medical Center. Three recommendations that we have for the Baylor Scott White healthcare system after doing this strategies and competitive advantage presentation is that they should improve their geographic concentration, extend their services to long-term care industries such as nursing home, assisted livings, and also increase education to healthcare professionals and public. With the baby boomers fixing to retire, we're going to need a lot more healthcare professionals to help us care for those people, as well as having classes for the public to educate them about their safety and preventing more diseases to spread are the three recommendations that we have for the Baylor Scott White healthcare system.